So welcome back, everyone. Give us just a few minutes as we transition back into the main room.
Hello, everyone. Welcome back. We'll give it 30 seconds to allow folks to grab some water from their breakouts. We hope you all had some really fruitful and engaging discussions. I know our group had to the very end, we're discussing the presentation. Some really great presentations today. I think most people are back from the breakout groups now. We'd like to just start with hearing from each of the breakout groups, kind of what you've learned or discussed. What were some of the highlights for you? So I can start with group A, which was health systems and services. Is there anyone from that group that would like to share out?
I'll start.
Sure, Lisa.
Presenters to jump in. Our topic was health systems and services, and it was a very enthusiastic group and discussion and covered a wide range of things. So our first topic was co-occurring health conditions of individuals with profound autism, findings across 3 healthcare networks, by Leanne DeWalt from the Weissman Center in Wisconsin. And we heard a methodology of using population-based information from an EMR system to look at individuals with autism and the co-occurring medical problems they had, and also to compare those with profound autism profile versus autism that was not an IQ less than 50, and came to the conclusion that that group with profound autism had more active medical problems. And there were also findings about the women versus females versus males, and the women were more likely to have endocrinologic problems, psychiatric visits, and sleep issues. And that was important information that could allow a more proactive approach medically. I was really impressed by the methodology and think that it's something we should use more. And it's dependent on coding in medical records that indicates who does have autism, what is the intellectual functioning, other kind of metrics that would highlight for us who fits into these groups and would allow us to be more proactive, perhaps in terms of autism-friendly care in hospital systems, and also preventive or proactive medical care. Our next presenters were Erica Phelps Nishiguchi and Roxanne Bristol from University of Hawaii, and they described something that built on the work of Dr. Brookman-Fries, describing an iterative pilot project proposal for group telehealth caregiver behavioral training in a developmental behavioral pediatrics clinic. And they started at a point at which many of us in this group probably find ourselves, where there's a very, very long wait for getting the clinical services that give an autism diagnosis. And then to give that diagnosis, then families still often have to wait for therapeutic services. And so their plan, their project is utilization of a modular telehealth learning system called ADEPT, and then to pair that with a weekly group, again on telehealth, where families could share their experiences and what they learned from that curriculum, and like a group behavioral training experience. And we definitely discussed that really would have a role as a way to reach more families at that critical point, and talk through maybe even ways to include others, whether it's grandparents or a wider community to help with interventions for families, including primary care. And then our last presenter was J.K. Young-Willows from University of Texas, Austin. And she introduced us to some new language and concepts in her study, Effectiveness of Stimulus Control Transfer Procedures from English to Home Language on Listener Responding Skills for Transition Age Individuals with Autism Spectrum Disorder. She really introduced us to this term heritage language, what the family is speaking at home, and how that may not have been the language that the child received intervention in, and now they're a transition age youth, and the importance of them being able to communicate in these basic ways at home and in their community to gain opportunities. And she showed through a sample of 2 and something that she plans to study more for her PhD thesis on how, with a simple strategy using ABA, that simple phrases that the family targets and prioritize can quickly become part of the child's ability in terms of listening response, and that the families had input on that. I'm going to open it up. Is there anything anybody wants to highlight that I didn't cover there? Or we had a lot of animated discussion.
That's a great summary, Lisa. Anyone else from Group A? All right, I will turn it to Group B, community-based lifestyle interventions. Does anyone from Group B want to give a quick summary or highlight?
I'll take the lead on it, Jackie. Thank you.
Great, thank you.
This was a really interesting session, and it covered some really innovative and thoughtful ideas. We heard from Manka Sustarik and Holly Mansari and Maria, who are from Hawaii at the Manoa Center on Disability, about a project they have of creating a really portable sensory integration center that could be used by students in the college setting, and not terribly expensive, about $750. And their study really found that it was something that folks really enjoyed. It was acceptable, very positive experience. We talked a lot about how to deal with cost and how to bring that to scale, and that was an issue, but it was also the thought of in their future work developing outcome measures that would be meaningful to administrators who would allocate space and dollars, and for all of us who are involved in conferences. One of our participants also said we ought to think about including that at conferences, as especially where we are bringing in folks where sensory is an issue for participation. Diego Forts from the Kennedy Krieger Institute and his mentor Miriam Afanudo did a really nice job talking about some work that they're doing with faith-based communities. They brought together a group of leaders, faith leaders, Christian and Jewish were the primary groups, and they asked them a series of questions about what they were doing for inclusion of people with disabilities within their congregations. And what they found, interestingly enough, was that many of the things that they raised questions about, the faith leaders hadn't really even thought about yet. And so it was a good training for these leaders to go back to their congregations and begin to think about how they could do things that would promote inclusion. It was a very nice piece of engaging the community in a way that was a little bit different for many of our things, and they really saw that it was a dual benefit program. Our next presentation was from Jenny Zhang, and Julia Heckel did the lead for us, along with Shay Williams and the faculty advisor Rebecca Huda, all from the University of Minnesota, talking about improving well-being through a community-based mentoring program for autistic adolescents and adults. And they had established a very nice program where mentors were paired with autistic adolescents and adults, and went through a mentoring session that lasted from January to June. They sort of addressed the unique needs of the individuals. The overall outcome was that folks really felt that it was a really positive thing. It was it involved really good outcomes. What they did get was that folks wanted it to be longer. They wanted more structure for the mentoring sessions, which were generally open-ended during this period. We did ask some questions about what training went in and what criteria we used for the mentorship selection, and they do a really nice job with background checks and ongoing mentorship support. So we were very happy to have that. And then our final presentation took us into the world of technology and virtual reality. Dr. Kristen Radonovich from West Virginia University presented on the project that was an SBIR funded project called Mirror Me, using a gamified VR to help build social emotional learning abilities. And we got a video presentation of what was involved in the training. And the work that they're doing is really quite exciting, and folks, the participants really enjoyed it. It was accessible. They had some very nice measures looking at its usability, accessibility. It had a favorable reception from educators and a high satisfaction from the children who used it. They do have plans now to move from what was essentially a feasibility study to be able to think about an implementation study. But they did say that that will require many more participants, so they're considering a multi-site trial. So Dr. Radonovich, you may want to put out a call to the network to see who might be interested in joining you in an application to expand it. So we went from faith-based training of church leaders to a mentoring program, to looking at ways to increase sensory integration, adaptability in the community, to virtual reality. So we had a lot of fun in our session today.
That sounds like a ton of fun. Thank you so much for sharing. Anyone else from Group B? That was very thorough. Great. How about Group C? Does anyone want to share?
Yeah, Jackie, thank you. I'll go ahead and give a summary. I'm afraid my summary is not going to be quite as amazing and comprehensive as the prior two summaries, but I'll do my best to just kind of emphasize some of the highlights. So our first presentation was by Dr. Benjamin Schindel. He spoke about age of autism spectrum disorder diagnosis in a nationally representative sample. And the key points were really that, as we know, age of autism diagnosis is related to a lot of sociodemographic factors. And so this work was validating that, but also showing emphasizing the importance of early intervention and how that can benefit health outcomes and socioeconomic outcomes. So that was a really nice way to kind of just start our group discussion. The next presentation was by Marilyn and Crystal, and they described findings from their dental clinic where they work, which specializes in seeing autistic dental patients. And so they spoke about the sort of primary objective of their study was to actually compare female and male dental patients with autism. But a lot of our discussion focused around the strategies that they used to be accommodating and to make this an accessible environment. They noted some of the traditional barriers that are seen in healthcare, things like, providers not being comfortable seeing autistic patients, or patients being turned away for their autism diagnosis. Those were really big motivators for the funding of this dental clinic. So that was really exciting to hear. Our third presentation was about exploring camouflaging experiences. And this was presented by Aiden and Emma. And our discussion really here highlighted the need for society's greater education of society and community on what is autism, what does it look like, but importantly, acceptance of autism, because that really drives impression management, camouflaging, masking, and the negative outcomes that can be associated with those things. And then lastly, Alex Newson and their team described their work on autistic educators and researchers and burnout in that population. And we had just a really lovely discussion on how to do participatory research. So tools and strategies that their team used to be inclusive and accommodating as possible, including strategies that they use to they themselves not burn out in the process of trying to do this important work in an authentic, inclusive way. So we had a nice discussion, and it was a nice sort of diverse set of presentations and speakers.
That was very thorough. Thank you so much. Does anyone from Group C have anything to add? I'm hearing silence, so well, thank you to all of our presenters, our faculty facilitators. That was an amazing group. So much to learn from. I recognize that we have only a short amount of time left. We do have a few questions that I will ask my colleagues to add those questions to the chat to talk about, as a group, how can the field of autism research translate its research to impact the community? What successes and challenges are there in trying to do this? And how can ARP help facilitate this translation of research? I know those are very big questions to answer in only a few minutes, but I will leave it open if anyone has thoughts on any of those questions. Feel free to unmute yourself, raise your hands. You can also add it to the chat. And I'll stop sharing my screen so I can see all of you. I know in Group A, we started to answer some of those questions. I know it's the end of the day, so we'll give it a few more moments. Oh, I see a hand raised.
I'll take a stab at it. I think for, the plenary session talked extensively about the implementation science pipeline, which was really helpful and really highlights, though, that one of the issues with translating research to community is time. I think this is also a recurring theme when we talk about community-based participatory research and getting community input meaningfully. And I think part of the difficulty in getting, researchers to commit to that time comes to just the funding priorities and the way we value research and the metrics we use for research productivity. Sorry, this is not specific just to the autism research field, so it's maybe a little broader than you were intending. But it would be, I don't know to what extent advocacy by AIRP or AUCD in getting some of these national funders to also change their priorities. I think that's what jumps to my mind when we're talking about big organizations that advocate for research being able to do to move the field forward. But that's just my 2 cents.
No, thank you for sharing. It's very important. I mean, having the funding behind it to be able to do it. Absolutely. I see Kristen. Let me know if that's how you pronounce your first name.
Yes, Preston. So I'll kind of jump off on that, the funding issues. Just getting any kind of external funding is harder and harder and harder, and it's just going to keep getting harder. And so I shared during my presentation that while we had gotten a phase 1 SBIR grant, we were not funded for our phase 2 project because our sample size was too small. And so, I think twofold. One is helping us connect through these kind of forums for multi-site work, having more power behind what we're doing. And then, dissemination of maybe some funding mechanisms that we don't know of. You don't always need the big NIH grant to work. There are some really interesting foundations and things out there, and some of us just don't have the time to keep looking for it. So maybe in those 2 ways, AIRP.
Thank you so much. Great points from both of you. Anyone else? And I see someone else put it in the chat. Funding is so important, and also qualitative and mixed methods research tends to be much slower than quantitative, and many of us may not be trained well. I took one qualitative course in fellowship, and my eyes were very open to the complexities, which often doesn't mesh well with training, research, and promotion timelines. Absolutely. Erin, I see that you have your hand raised.
Yeah, so I think it's really important now that the autistic community has so much access to information and is really building a strong community around what research benefits us versus what research was clearly not done in communication with us. I think it's really important for non-autistic and autistic individuals and researchers to be working together to make sure that there is really great research being done in the medical space, but autistic members of the autistic community are very sensitive to the motivations behind that research and who is conducting that research, and making sure our best interests are being kept in mind through the whole way. So I think all of the collaborative methods that were spoken about today, the participatory models, the working together between autistic and non-autistic researchers and community members, I think that's really essential to make sure that the research findings that can really help the autistic community are reaching the community and are responsive to the community's needs and desires for what will actually help us.
Very important. Thank you. And then I just want to make sure there's a question in the chat, and then Calliope will go to you next. One consideration is the assent processes we are using in behavioral research with the autistic community, but my personal experience as a provider and self-reflecting on some of the criticisms of applied behavioral and analytic services from self-advocates, we should consider more inclusive assent procedures to support all levels and abilities of communication and ensure their experiences and preferences are considered in the interventions we are using, instead of defaulting to caregiver or parent support for services and interventions. Great. Calliope?
Thank you. I really want to echo all the points that that everyone has made. And the one thing I wanted to add, which I think aligns well with sort of the discussion around the funding, is that I feel like as researchers, and for those of you who are clinicians, we're so often just going from one thing to another and trying to meet these deadlines and get this paper out and write this next grant. And it's not necessarily conducive to having these deep conversations that need to happen about what we need to do in the real world to change things and make things better. And I've increasingly found that even just having a couple hours here and there to talk with colleagues about the important issues that we're grappling with, I find like we start coming up with really creative solutions. And it's just such a shame that we don't have more of that time available to us, because I feel like that is really what we should be trying to do. And yet we have this obstacle of always being sort of just overwhelmed with the stuff that we have to get done. So I know AARP puts together just so many wonderful events and trainings and webinars. And something I guess to consider is, how we can use this platform to create more spaces to have these really sort of deeper, longer conversations where we can hopefully make progress on moving the needle on some of these things, instead of sort of always just saying like we do, well, this is a problem, more research is needed, and then like, let's move on to the next task on our list. So I know I'm sort of preaching to the choir and we're all grappling with this and our many obligations, but I feel like that is probably an important thing that needs to happen.
Absolutely. We need 25, 26 hours in a day, if not more. I know that we only have a few more moments until we end today's session. Any final comments on these questions? And you can feel free to reach out to the AARP program manager, Dana Kim, and we can put her email address in the chat in case there's any other additional thoughts that may come up from this discussion. Great. Well, I want to thank you all and let me share my screen. Thank you all today for the valuable discussion. Thank you to our presenters. Thank you to our faculty facilitators. Thank you to the AARP network staff. Thank you to the AUCD staff. Thank you to NCHB and to all of the attendees. We couldn't have had this event without you. Again, please take a moment. You'll notice we'll also have it in the chat, but also on the screen, you'll have a survey link in the slides. Please take a moment if you want to take it for the last 2 minutes to complete the evaluation and tell us what worked well, what we can do better, and what topics that you'd like to hear about in the future for AARP Research Days. This event was recorded and will be available on the AUCD event page soon. I just want to thank you, and I hope you'll attend our last session of the Autism CARES virtual series for this summer, which is the WESTAT. This is the end of the day talking. WESTAT presents Autism CARES Evaluation Update. It is next Monday at 3 p.m. and the registration link we will also put in the chat. I want to thank you all for attending and feel free to stick around if there's any further questions. Thank you all.